The United States is facing a surge in viral infections. This wave is causing concern among public health officials and healthcare providers. We are seeing a rise in cases of 4 main viruses. These viruses are influenza, COVID-19, RSV, and norovirus. While not technically a quademic, the simultaneous circulation of these viruses poses a significant challenge. It is essential for everyone to be aware of these viruses. We must understand how to protect ourselves and our communities. This surge in viral infections is putting a strain on our healthcare system. Hospitals are seeing an increase in patients with respiratory illnesses. This increase in patients is leading to longer wait times and a shortage of resources. It is more important than ever to take steps to prevent the spread of these viruses. The good news is that we have tools to combat these viruses. Vaccines are available for influenza, COVID-19, and RSV. These vaccines are safe and effective. They can help reduce the severity of illness and prevent hospitalization. In addition to vaccination, we can all do our part to prevent the spread of these viruses by washing our hands frequently, avoiding close contact with sick individuals, and staying home when we are sick. By taking these simple steps, we can all help protect ourselves and our communities from these viruses. Influenza, commonly known as the flu, is a respiratory illness caused by the influenza virus. This virus is highly contagious and spreads through droplets from coughs and sneezes. The flu can cause a range of symptoms, from mild to severe. These symptoms can include fever, cough, sore throat, muscle aches, fatigue, and headache. In some cases, the flu can lead to serious complications, such as pneumonia, especially in young children, older adults, and people with weakened immune systems. The Centers for Disease Control and Prevention, or CDC, estimates that so far this flu season, there have been at least 20 million illnesses, 210,000 hospitalizations, and 13,000 deaths from the flu. The CDC recommends that everyone 6 months of age and older get a flu vaccine every year. Getting the flu vaccine is the best way to protect yourself and your loved ones from the flu. The flu vaccine helps your body build immunity to the virus. It reduces your risk of getting sick with the flu. If you do get the flu after getting vaccinated, your illness is likely to be milder. COVID-19, the disease caused by the novel coronavirus SARS-CoV-2, continues to circulate globally, even as other viruses reemerge. While the pandemic phase has passed, COVID-19 remains a public health concern. New variants of the virus continue to emerge, some of which may be more transmissible or cause breakthrough infections. The good news is that we have learned a great deal about COVID-19 over the past few years. We have effective vaccines and treatments that can significantly reduce the risk of severe illness, hospitalization, and death. However, it is important to stay vigilant and continue to take steps to protect ourselves and others. The CDC recommends that everyone stay up to date on their COVID-19 vaccinations, including getting booster doses as recommended. You should also continue to practice good hygiene, such as washing your hands frequently and avoiding close contact with people who are sick. Wearing a mask in crowded indoor settings, especially if you are at high risk of severe illness, is also a good idea. Respiratory syncytial virus, or RSV, is a common respiratory virus that usually causes mild, cold-like symptoms. However, RSV can be serious, especially for infants and older adults. In infants, RSV is the most common cause of bronchiolitis, which is inflammation of the small airways in the lungs, and pneumonia, which is an infection of the lungs. RSV typically begins circulating in the fall and peaks in the winter. Symptoms of RSV usually appear within 4 to 6 days after exposure. These symptoms can include runny nose, cough, fever, wheezing, and difficulty breathing. In infants, RSV can cause irritability, decreased activity, and poor feeding. There is no specific treatment for RSV, but there are things you can do to relieve your child's symptoms. Make sure your child gets plenty of fluids. Use a cool mist humidifier or saline drops to help clear their nasal passages. Over-the-counter pain relievers, like acetaminophen or ibuprofen, can help reduce fever and pain. Section 5. Norovirus, the unwelcome guest. Norovirus is a highly contagious virus that causes vomiting and diarrhea. It's often called the stomach flu, but it's not related to the influenza virus. Norovirus outbreaks are common in settings where people are in close quarters, such as schools, daycare centers, nursing homes, and cruise ships. Norovirus spreads easily through contaminated food and water, contact with contaminated surfaces, and person-to-person contact. Symptoms of norovirus usually appear 12 to 48 hours after exposure and last for 1 to 3 days. These symptoms can include nausea, vomiting, diarrhea, abdominal cramps, fever, headache, and body aches. There is no specific treatment for norovirus, but it's important to stay hydrated by drinking plenty of fluids. You can also help prevent the spread of norovirus by washing your hands frequently with soap and water, especially after using the toilet and before eating or preparing food. Clean and disinfect contaminated surfaces with a bleach-based cleaner. Wash laundry thoroughly with detergent and hot water. One of the biggest challenges posed by this season's surge in viral infections is the difficulty in distinguishing between them based on symptoms alone. Influenza, COVID-19, RSV, and even norovirus can present with overlapping symptoms, making it difficult to determine the cause of illness without testing. For instance, fever, cough, and fatigue are common symptoms of all 4 viruses. Similarly, muscle aches and headache can occur with both influenza and COVID-19. This overlap in symptoms highlights the importance of seeking medical advice for diagnosis and appropriate treatment. Your doctor can perform a rapid test or order a laboratory test to determine the specific virus causing your illness. Knowing the cause of your illness is crucial for several reasons. It helps determine the appropriate treatment, allows for better isolation measures to prevent further spread, and provides valuable data for public health surveillance. While the prospect of multiple viruses circulating simultaneously might seem daunting, it is essential to remember that we are not defenseless. Many of the preventive measures that are effective against one virus are also effective against the others. Vaccination remains a cornerstone of protection against influenza, COVID-19, and now RSV. Staying up to date with recommended vaccinations can significantly reduce your risk of infection and severe illness. In addition to vaccination, practicing good hand hygiene is crucial. This means washing your hands frequently with soap and water for at least 20 seconds, especially after using the toilet, before eating, and after coughing or sneezing. If soap and water are not available, hand sanitizer containing at least 60% alcohol can be used. Other preventive measures include avoiding close contact with sick individuals, covering your mouth and nose when you cough or sneeze, and disinfecting frequently touched surfaces. Wearing a mask in crowded indoor settings, particularly during periods of high viral activity, can also help reduce your risk of exposure. Treatment for viral infections generally focuses on managing symptoms and supporting the body's natural defenses. Rest, hydration, and over-the-counter medications for fever and pain relief are often recommended. In some cases, antiviral medications may be prescribed, particularly for influenza and COVID-19, to shorten the duration of illness and reduce the severity of symptoms. It is essential to follow your doctor's advice for treatment and isolation to prevent spreading the virus to others. If you are experiencing severe symptoms, such as difficulty breathing, chest pain, confusion, or persistent vomiting, seek medical attention immediately. While there are no specific treatments for RSV or norovirus, supportive care measures, such as maintaining hydration and managing fever, can help alleviate symptoms and prevent complications. In infants with RSV, hospitalization may be necessary to provide respiratory support and oxygen therapy. Staying informed about the circulating viruses and following public health recommendations is crucial for protecting yourself and your community. The CDC provides up-to-date information on its website and through regular health advisories. By staying informed, practicing preventive measures, and seeking medical advice when necessary, we can navigate this wave of viral infections and minimize their impact on our health and well-being. Remember, we are all in this together, and our collective efforts can make a significant difference in protecting public health.